Sometimes there could be small swelling in the neck, they are basically lymph node swelling. And people get worried, all of a sudden they notice while they're feeling their neck that there is something that is enlarged. Now, lymph nodes, it can be acute lymphadenitis or chronic. Acute lymph nodal, presentation is not that much worrisome because it's usually following some infection. But chronic, which means painless lymph nodes, they can be having some underlying disease. Either it could be tuberculosis or it could be cancer somewhere inside, which is presenting as this lymph node because the cancer could have spread in the lymph node, which is called metastatic disease. So lymph nodes should not be ignored. If a lymph node is felt in the neck, it means already that it is more than 1 centimeter in size, and normally the nodes should be less than 1 centimeter. So if you've already felt them, you should go to the doctor and get it screened and understand why it has come up. Sometimes simple procedures like ultrasound of the neck or needle aspiration studies can tell us, and apart from a thorough endoscopic examination of the ear, nose and throat area, can tell us the reason for the cause of lymph node enlargement. Thyroid swelling, there can be many reasons for it. There can be something that is benign, that's called colloid nodule, or there can be something that is causing a tumor inside. Solitary nodules, which means a single node in one of the lobes of the thyroid, can be inhabiting a cancer. The thyroid cancers are pretty much good to have, in the sense if you don't have a choice and you're supposed to be suffering from cancer, God says you have to have some cancer, well, you have to have it because I've decided. Then if you're asked, then as a choice, then you would say it's thyroid cancer. Why? Because the treatment is very good for thyroid cancer. The survival rates are very good. They can live for many, many years because thyroid cancers are well differentiated cancers. They're slow growing and they can be completely cured. And with the advent of robotic surgeries, there is no scar even in the body, and nothing visible in the neck. It can be taken care of by robot-assisted surgeries. That cancer can be completely removed without any damage to the nerve. But again, what I'm trying to say is, if you have noticed a swelling in the thyroid, you must go to your doctor and get yourself checked to see if it is benign pathology or a cancerous pathology, because you're not going to have any pain or any bleeding or any other symptom. It will be just a mere swelling in the thyroid, which is right there in front of the neck. So the doctor will examine, feel the thyroid and tell you what the cause could be, and also get simple methods like ultrasound done. Very rarely a CT scan is required if you have suspected cancers like papillary cancer. And apart from this, an FNAC, simple needle insertion, will give us a cytological picture and tell us what the diagnosis is. And